Everyone has something they are afraid of, and we all feel fear from time to time. However, fear can come from a situation that isn't expected. Phobias and panic disorders can lead to having so much fear that it disrupts our normal routine or finishing goals. Advice isn't a set of instructions. It's more like a paint supply store. You give the seeker the colors and the canvas, and it's up to them to make something of it, or ignore it altogether. What is panic disorder? Panic disorder involves repeated and unexpected panic attacks. A panic attack is a feeling of intense fear or terror that lasts for a short period of time. It involves physical sensations like a racing heart, shortness of breath, chest pain, dizziness, shaking, sweating, or nausea. Some people feel like they're having a heart attack or suffocating, or fear that they are dying. However, a panic attack goes away on its own. Panic attacks can be a normal reaction to a stressful situation or part of another mental illness. With panic disorder, panic attacks seem to happen for no reason. People who experience panic disorder fear more panic attacks and may worry that something bad will happen as a result of the panic attack. They may avoid places, sensations, or activities that remind them of a panic attack. Some people avoid any situation where they can't escape or find help. They may avoid public places or even avoid leaving their homes. This is called agoraphobia. What are phobias? A phobia is an intense fear of a specific thing, like an object, animal, or situation. Two common phobias include heights and dogs. People with a phobia can change the way they live in order to avoid the feared objects or situation. People can manage their fears, like being afraid of needles and still going to do blood tests. The issue is when the phobias start to rule your life and make it impossible for you to do things or stay healthy, like the fear of needles, not going to get any blood test done ever because of the needles. Who do they affect? Anyone can experience panic disorder or phobia. No one knows exactly what causes phobias or panic disorder, but they are likely caused by a combination of life experiences, family history, and experiences of other physical or mental health problems. How can I help a loved one? Many people who experience anxiety disorder, like panic disorder or phobias, can feel ashamed about their experiences. They may blame themselves or see their experiences as a problem with their personality rather than a disorder. Support for not only your loved one, but for yourself as well, can help you deal with the stress of taking on another person's disorder. Remember that the person has the disorder, they are not the disorder. The person's fears can seem ridiculous and unrealistic, but they are very real for the person being affected and should be treated as such. Don't tell them to stop being so ridiculous, because chances are the person already feels bad enough for feeling afraid or panicking over something. You should not have to take over the person's life because of the panic or fear. They are more than capable of doing everyday tasks. Just like any other disorder, you might want to seek counseling. It is perfectly acceptable to set up your own barriers and to seek support. You could also do family counseling, which might take some of the stress out of the relationship. Be patient. It takes time to learn new skills and to put those skills into practice. If you see your loved one using the skills in action, celebrate that achievement. If you have phobias or panic disorder. Most people who experience problems with anxiety recognize their fears are irrational but don't think they can do anything to control them. Anxiety disorders are treatable because recovery isn't about eliminating anxiety, it's about managing the anxiety so you can live a fulfilling life. A common theme in anxiety disorders are physical health problems with the heart or thyroid gland. If you are noticing that you are experiencing panic attacks more often after being diagnosed with issues dealing with the heart or thyroid, you should talk with a healthcare professional. You might want to try counseling or support groups both on and offline. Being with like-minded people might make you feel less alone. It also might help in dealing with a disorder once you hear other people's phobias and how often they have panic attacks. You might be put into CBT, cognitive behavioral therapy. This will teach you skills to help decrease the amount or duration of your panic attacks. You might also be put through exposure therapy to help you with your phobia. Exposure slowly introduces feared things or situations. Self-help strategies include keeping yourself healthy, eating, sleeping, exercise, and personal hygiene, and researching CBT strategies, and do some at home with your partner or friends. Medication. Anti-anxiety medication may help for short-term difficulties or situations, but usually isn't the best option for long-term use. Some types of antidepressants can help with anxiety, and they can be used for longer periods of time. It's important to remember that medications can change all of the thoughts, feelings, and behaviors that drive anxiety, so counseling is usually recommended. Some people take medication until their anxiety is controlled enough to start counseling. Seeking help is not a life sentence. Once you can manage your disorder, it can no longer rule your life. Please note that any advice I give here should be taken with a grain of salt. Everyone's life is a different story, and these are merely generalized tips. Results will vary. If you would like to ask me for advice, please email or Facebook. My links are in the description. I know you can pick any YouTuber to watch, so I just want to thank you for picking one of my videos. I hope it helped.